Hi, my name is Dr. Nicholas Tsamparlis, and I'm a newly hired internist with Northeast Medical Group at the Stanford office. About 1 year ago, I was working 12-hour shifts at a tent outside of the emergency room with 2 medical assistants and a secretary. We were seeing COVID patients and patients who had similar symptoms. I and 4 other doctors volunteered to work there. I can tell you I was probably safer from contracting COVID than in my own office. We had supplies, we had running water, we had heat, and there was plenty of food. My point of mentioning is that as of today, March 23rd, it's probably better or safer to see your doctor than visiting a grocery store. So that when you do visit your doctor, you should have 3 points in your mind. 1, does the staff and patients wear masks at all times? Are there enough masks and protective gear? And is there a limit to how many people could be in the waiting room and the offices? Obviously, there's a lot of anxiety since last year about seeing your doctor in person, but if you feel comfortable and safe, then there shouldn't be any hesitation in coming in to see your doctor. Recently, there was an article in the American Journal of Medicine, January 2021, and the title was The Telehealth 10, a guide for a patient-assisted virtual physical examination, where the patient does the vital signs, examines himself under the guidance of the physician while under telehealth, and that the numbers and the examination is based on the interpretation mostly of the patient. This is a trade-off, and I think that it's not as good as having you come to the office because the patient's gathering the information, whereas you want a clinician who has more experience to be able to evaluate you and understand your medical problems. So the concern is, if we are doing telemedicine, what are the physician and the patient missing? So you know the expression of going to see your doctor has a level of reassurance. A friend says to you, what's going on? I have a pain, I'm going to see the doctor. As opposed to, well, I'm going to see him on telehealth, and that's not as much help. So a physician can put his hands on you, examine you, and tell you what is true or not, rather than having it seen through a computer screen. So many times I've examined patients after we've had a discussion on telehealth, and they come in and I tell them, well, this is a muscle strain, this is a swelling that you don't have to be worried about. And for the most part, they feel more reassured than having it done through the telehealth. Physician in Latin means teacher, and as such, we teach you about your body, your health, and in terms of the physical exam and the amount of time that you have, 40 minutes on average, there are, probably several components to the physical exam. One is when you come in, the vital signs, blood pressure, the temperature, respiratory rate, your oxygen level, and your weight. And those things we can graph, so that if you gained 3-4 pounds from last year, either due to being home all the time, obviously due to the pandemic, having takeout food, which has usually higher amounts of salt, at least we can adjust that, because 3-4 pounds every year, after a while, can make a big difference whether you are hypertensive or diabetic. In terms of lab tests, as you know, it's the blood count, the cholesterol, the kidney function, the liver function. For men over the age of 50, we discuss it with them, but we check for the PSA, for the prostate, to see if there's any concerns of cancer. And for people who have hypertension or chest pains or whatnot, we're able to do an electrocardiogram as a first step to see if there's any other issues that they're having with regards to their heart. So why is the annual physical important for you and for your doctor? is because you get a baseline. You know, 2 points is a straight line. So if that line is straight, then you're in good shape. If one line is like this and the other line is like this, your diabetes, your weight, your blood pressure, whatnot, it can help you in regards to your overall health. So the question was raised that why do it at such an early age? Well, some patients want to get a baseline because of their family history. They're 21 years old. My father has this, my mother had that. So I don't think there's any type of restriction in regards to that. But obviously, after you get to your 40s, 50s, and of course 60s, it should be something that should be taken care of. The other thing that we talk about is vaccinations in light of the pandemic. Right now we have the 3 vaccines that are available, with a possible 4th, depending upon what the FDA decides to do. But with the Moderna, the Pfizer, and the J&J, there are, of course, the first 2 are 2 shots, and the third one is just 1 shot. Moderna and the Pfizer have a higher rate of control and protection as opposed to the Johnson & Johnson, which has less. So yes, there are interactions patients do get. For myself, I had my first shot of Moderna. I had muscle aches and pains almost immediately, as opposed to when I usually get a flu shot, usually is the next day. But my second Moderna shot, I just personally, I did have overnight muscle aches and pains plus fever and chills, which went away the next day. So I guess it depends on the individual what type of shots they want to take. Another thing is in regards to the Shingrix, which is the one 50 and above that prevents you against the shingles. Patients are debating whether to get the Shingrix or to get the COVID-19. As long as there's 2 weeks in between one shot and the other, I think it would be a good thing. The other vaccines, of course, are the diphtheria, tetanus, pertussis, DTP vaccine we give every 10 years. The pneumonia vaccine, which we give to patients over the age of 65, because pneumonia is more likely to occur and cause mortality in older patients. But if you have asthma, COPD, or something of that nature, you can get those shots earlier. I just want to go back and talk about blood pressure when we're talking about the exam. That when you do the blood pressure at home, first thing is the one that you do by the wrist that you hold like this, most of the time is 10 to 20 points higher, because blood pressure is better here, you know, higher up, closer to the heart. So the one that they do at the wrist or the ones they do at CVS are not as accurate. Secondly, the one that's done here at home, most of the time patients are told that they should flex their arm. It actually should be straight out. The cuff should be loose, not tight. And you should sit down for 5 minutes at least before you push the button and it causes the blood pressure to be taken. This is why we usually be better to take it in the office. And a lot of times patients come in with their blood pressure cuffs and we compare the two and stuff, as long as they're shown the right way to take the blood pressure. In regards to the physical exam, I think it's important to be able to go from head to toe when a patient comes in, and more importantly, to see what's going on with someone who's 30 years old as opposed to someone who's 60 and 70. It's amazing sometimes that patients complain of foot pain, knee pain, and then you flip over their sneaker and you see how they have had that sneaker for more than 6 months, more than a year, and it's eaten away, and it causes issues with their walking. Same as patients who are now working from home, and in terms of the level of their computer, if they look too high or too low or constantly moving their head side to side, it's usually difficult to explain to them that what they do every day seems to cause the problem. And then going into somebody who's older, 60, 70, and 80, they come in, first thing they do is they have maybe a cane, and the cane is not giving enough support. More than anything, the cane at the bottom, the rubber is like eaten away. And you point that out, that's not as good as perhaps a quad. And then you see them perhaps with a walker, again, the same thing. I mean, it's amazing how patients appreciate that when you point out these things in terms of coming into the office and examining them, examining their lives and their risk factors, especially the elderly who have a higher incidence of falls. So in summary, I think it's a good idea to have an annual physical exam. I think you should talk to your doctor in his or her office, and so you could be examined physically and to get the proper tests and to maintain your health for longevity. Thank you. Are there any questions? Thank you. I usually, since I've been here, I notice that patients are getting blood work before so they can come in and discuss it with their doctor. But I feel more comfortable seeing the patient and ordering the tests and doing them the same day and then having a discussion rather than missing out. I mean, I don't think it's a good idea to have 2 phlebotomies because of one thing or another. So for me, I think it's best to do it, to order it that same day after seeing the patient. Okay, it's 11:20. Thank you very much.